Hi, everybody. So this is the second of two tilt table videos that I'm doing. The first one was about just what the experience was, what you can expect um, in the tilt table test itself. And something that I forgot to mention actually is they are going to prick you for an IV. Uh, they want you fasting, so that in case you become nauseated as you're moving around, you don't kind of have anything in your stomach. But they are going to prick you for an IV. So that worked out not disastrously for me for some reason. She must have just been really good at it. Um, but I was worried when I saw that they were going to do it because I was like, y'all, you told me not to eat or drink anything for, 8 or 12 hours and I, haven't. And now I'm dehydrated and now you're going to try to find a vein. Like, good luck. So do bear that in mind. They did tell me that I could have some water, that morning, but they just said, just have like not very much. So you know your body better than they do. You know if you're likely to throw up when they move you around. They're not going to move you around super fast. I thought that the tilt table was like like one of those NASA machines where they kind of whirl you all around, or like an inversion table where they could kind of whip you one way or the other. That's not what they're going to do. So unless you have really severe nausea right now, which I know, sometimes we do, or unless you just have great veins and you can always find one. I would definitely, try to drink a quart of water before you go in there, so that they can for sure find their vein real easy. Now, this video, though, is really about the symptoms that I experienced during the tilt table test. It's important to note I have very mild POTS. It has been increasing over the past several months, and so that's why I wanted to go ahead and get the test at this stage. But it's not super severe like some people I know who are, really struggling with like 35 beats a minute, 1 minute, and then like 130 or more the next minute. I don't have that level of POTS. So if you do, um, you know, bear in mind that my experience is just my experience. You may have a different one. I would also say if you do have severe POTS, and Pedialyte agrees with you, that is definitely the highest recommendation and the least, gross and multicolored and stuff recommendation that I've gotten from my dysautonomia engaged cardiologist, not the other cardiologist who's kind of not as good at this. So I'd say if you do have severe POTS, have enough Pedialyte in you before you go that you can function. But you don't want so much in there that you don't have the reaction that you need to show as well. The biggest struggle for me, or one of the big struggles for me this month during all my testing, has just been that I can't do all the usual things that I would do to self-medicate. There's lots of things that I do to make my symptoms reduced, eating certain ways, doing some kinds of activity and not others, and just all kinds of things that I manage almost unconsciously at this point to keep my symptoms as manageable as I can. And I had to make a conscious effort this month traveling, even with all that extra stress of traveling and testing, to not do any of those things to the degree that I could handle it. Um, and that's been a struggle. So here are my symptoms as I went through it. And as I said in the last video, which you can watch in more detail if you want, you're basically going to be strapped to a table, flat on a lab table, and then you're going to be brought up, not super fast. It's not going to be like, boop. It's not going to be like that. But you're going to be brought to one level, brought to the next level. I think it's 30, 60, and 90 degrees is probably the test point. And you can probably look that up in more academic space what the test points are. You'll have your feet will be stable, because it's like a dolly. It's like a hand truck. So your feet are gonna be perpendicular to the back area, and you're going to be strapped in. You have the option of having your arms out or in, whatever feels better for you. So my symptoms were many. really past a certain point, I was talking the entire time saying, okay, now my body's feeling this way. Now my body's feeling this way. One of my symptoms was neck pain. For me, that was largely because the hotel I stayed at was trash, even though it was medical housing, and so I had already neck pain from the pillow that was like a brick that I had slept on the night before. Um, but that's one thing. I also experienced a different kind of dizziness than I usually do. I experienced dizziness that I guess the way I described it was it's outside, it's not up here. It was like outside of here on both sides of my body. Um, I also, at different positions, experienced more oval side to side kind of dizziness. And then at a different position, I experienced more oval front to back dizziness and lightheadedness. And for me, dizziness and lightheadedness like really just go hand in hand. I don't often have full room spinning dizziness, um, but I almost always at this point am more than lightheaded. It's more than lightheaded. It's definitely like my sense is that the earth is spinning, whether I can see it or not, kind of thing. And of course, the earth is spinning, but that's not really probably what I'm dealing with here. So, um, so those were some things for me. I also had pain going down. All right, this looks like the left side to you. It's the right side for me. Down this way, and then kind of over. And then that pain went back further into the body as I went sort of deeper, kind of into the rib cage, and then around to the back. That persisted pretty much the whole test. None of these were like insane levels of pain. None of these were insane levels of discomfort. But at some point, I did get aware of like when I would report the issue to her again as she's writing it all down. I said, okay, what I mentioned about it a minute ago was probably a 3 level out of 10. This is at a 6 level now, kind of thing. Ultimately, I had some symptoms that were up to a 7, kind of a low 7, you might say. Most of my symptoms did get to between a 5 and a 7. I didn't get into like the 8 to 10, more severe range. There were a couple of things that got kind of close, but because I'm so used to pain right now, it didn't phase me per se. So, so that's the level of discomfort I was dealing with. I experienced after a while sensation in my feet, discomfort, and kind of tingling in my feet. It was not comfortable. I had my eyes closed, and actually, maybe I should have opened them because I might have experienced a vision change. But it felt so important to me to really focus on the body and feel what I was feeling that I did not want to include external things. It was easier for me to concentrate on those sensation changes if I kept my eyes closed. But if you kept your eyes open, you might notice, those eye changes. And I probably would have had eye changes because I do. So those different dizzinesses, those different kind of lightheaded things, just being specific about where you're experiencing them, kind of in the auric space, you might say. I ultimately, toward the end, I had pain right here, the lowest sinus area. And I just described it as, the level of the bottom of my nose, sinus pain. I don't recall if I had ear issues. I don't think I did, but my neck pain did change throughout. It's first it kind of went away, and then it came back, and it was a different kind of pain than what I had come in with, so it felt worth mentioning. And then it really changed. It traveled kind of up, kind of toward that joining place between the head and the neck, and then it went down further, and then I had some kind of upper middle neck or back pain kind of all the way across, and then I had it went kind of lower, and then it was more full back, not all the way to the lower back, but it was full from kind of shoulders down. I also really notably had a lot of shaking, like twitching kind of shaking. It started internal, and I mentioned it feels like I'm shaking inside. It wasn't like an unsteadiness shaking. It was definitely like a twitchy kind of shaking. My knees, particularly my right side, really ended up twitching a lot, and that became about half the test. So just as you're changing where things are twitching, um, if that happens to you, you'd want to mention that. This is the level of granularity that I'm talking about. You might have completely different symptoms than I had in mine. But again, it wasn't anything scary. I did have the sense that, if I needed to stop, I could say, I need to stop. Um, again, it was at the end of a lot of testing for me. What I mostly experienced in terms of like real distress was before the test. She wanted me to tell her my whole medical history, but she wasn't giving me a form. She wanted me to do it orally, and I was like, "Fuck that!" I've, I've filled out forms for a zillion different people, and I could have filled out forms for you, but I'm not going to try to remember my whole medical history. And what you mean by medical history could vary wildly, right? Like some people give you 3 forms, some people give you 25 forms. So I was really not having that, and I was really disturbed by that. I think partly it's just an insensitive way to take somebody's medical history, but I think bigger than that, it was a PEM issue. I had already been through several days of brain function testing and memory testing, and had already collapsed and failed on all of them. And so somebody asking me to remember my entire medical history, I was like, that's how I feel about that. So I was not super nice about it, because I really, I just feel like it's an ableist ask. I mean, somebody's coming in, they're in a gown, half naked, for a cardiac procedure, and you're asking them to do intellectual, some cartwheels for you at 8 o'clock in the morning, and I just was not really having it. So we got to the basics of what she needed, but I'm like, you can ask for my fucking patient record if you want to know that much about me, or you could have like sent me intake forms if you wanted to know all this about me, but I'm not going to rattle this stuff off to you. I'm here for a test, and that's what I'm doing. Um, do note it did take they took me in about 20 minutes early because I was there real early, and I was hoping they'd take me in early, and they did. I think if you had fewer symptoms, or much clearer, like high-low reactions, you might get done earlier, but then you might need more rest time. They give you some rest time, but they're not super heavy-handed about it. They did ask me if anybody was going to drive me home, and I'm like, no, why would I have a butler just because I'm sick? And um, but they were okay with that. I think some procedures there, they make you bring a person to drive you. They don't with this, as long as you look like you're with it. But they rest you here for a while. Okay, so you're going to get some downtime. Even if you were in traffic and whatever, you're going to get about 10 minutes of downtime, and then they're going to do this, and they're going to do this, and they're going to do this, and then they're going to take you back down, give you a good few minutes to stabilize, and the last thing they do is take the IV out. So even like once you're sitting up and in their chair and stuff, and are like dressed, the last thing they do is take the IV out. So if you happen to need some saline or something, they would have a way to do that. They do it at a hospital, so if something terrible happened, they could manage that. But it would be unusual for something major to happen. So I hope that's helpful. But just keep in mind, just get very aware. Practice. If you're not used to being attuned to your body, my advice would be to really practice writing down your symptoms. I know it's hard when we have so many symptoms all day long. Those of us who have a lot of conditions, we get used to them, and we don't feel like they're worth mentioning anymore, or we don't even notice them anymore, right? They're our normal. I think it was really important, especially for mild POTSies, and for people who don't know if they have POTS. If you're going to invest in the test, which was still $350, even with my insurance covering the vast majority of it, still $350 for me. Give them every symptom change. And if you I know you can't control who administers your tests, so hopefully they'll write everything down. I was kind of surprised she did because she was kind of ticked off at me for not giving her full medical history, but but she was typing the whole time. Once I started giving her symptoms, she was typing. She was typing. So I'm just really glad that I have all that documentation now. That even if we're not seeing enormous changes in my heart rate, and I don't know what those changes were, if they were amounted to anything, or blood pressure, I could still, she's still got documented. These are all the things. Now, I will also say, and I've said this before, never go into any kind of medical conversation without audio recording it. I always, always, always have my backpack with me. I always, always, always have that voice memo on in my phone. And even if it's 5 hours and, three of them are waiting around for somebody, it's on the whole time. So that was on. And so I will also have a record of my symptoms that I can go back and compare. If she did shitty record keeping, I will be able to check that. If I get that record and I'm like, she only wrote down 3 things, this is trash. I can write it down and send it to them and say, fix my patient record. This is what I said. So I hope that's helpful for people who are kind of on the fence, don't know if a tilt table would be helpful or not. Whether it is or not, for your POTS diagnosis, it could be very helpful for your PEM understanding, for your ME understanding, or for other conditions if you have $350. There you go.